down. Since yesterday, about 4,000 new COVID cases were reported, bringing the state total to more than 312,000. There were still almost 300 deaths reported, and overall, hospitalizations and intubations are down. In our area, Livingston County is reporting 80 cases today. 5 of them are new. Monroe County is reporting almost 650 new cases and over 120 deaths. Almost 100 people are in intensive care in Monroe County on ventilators to help them breathe. It's a tough procedure for patients and doctors alike, and a new device could help make it safer for both. Sabrina Maggiore brings us more.
That's right, Jack. A team of emergency doctors and engineers from the University of Rochester teamed up to bring intubation boxes to hospitals in our area. And it all started when healthcare workers came back from fighting the coronavirus in New York City and wanted to apply some of what they learned. When this team of URMC doctors returned from fighting COVID-19 in New York City, they were looking to bring what they learned about the virus to hospitals here. That's why they approached Greg Godowski.
The ER group came to us to ask if there was any way that we could assist in making a box similar to what they had been trying to use in New York City.
This plastic box protects caregivers when they're intubating COVID-19 patients. That's the procedure that places a tube in a patient's throat so that they can breathe with a ventilator.
So they're often, when there's not a box, though, they're often, within 1 or 2 feet of the patient's head when they're doing that procedure. So they're fairly close. They now have tools that are video assisted, which allow them to do it at a distance. But in most cases, the clinician is very close to the patient and is at risk because things are in close proximity.
The box is used to contain the virus, literally blocking virus particles from spreading to others in the emergency room.
It's all about protecting the caregiver, right? And so not just the ER clinician that's doing an intubation to put the person on ventilator support, but all of the other support personnel that are in the emergency room at the time that the procedure is being done.
The intubation boxes are already being used locally. They're helping those risking the most on the front lines stay a bit safer. Now, Greg Godowski says the project was a successful team effort. The team worked quickly to produce the intubation boxes. They had a prototype within a day, and they had the final version within 2 weeks. For News 8, I'm Sabrina Maggiore. Back to you.
Thank you, Sabrina.